Almost 30 million Americans were considered to be current illicit drug users in 2014, meaning that they had abused drugs within the month leading up to that year's National Survey on Drug Use and Health, NSDUH. Drugs interact with the brain and body to alter moods, emotions, and behaviors by changing brain chemistry and a person's perceptions, and by impacting how individuals interact with the world around them. Regions of the brain are disrupted by drug abuse, as the National Institute on Drug Abuse, NIDA, reports that the brainstem, limbic system, and cerebral cortex are all affected. The brainstem controls life-sustaining functions, including sleeping, breathing, and heart rate, while the limbic system holds the brain's reward circuitry and helps to control emotions and the ability to feel happiness. The cerebral cortex is considered the thinking center of the brain, managing problem-solving, planning, and decision-making abilities as well as helping people to process information provided by their senses. The more often drugs are used, the more they will impact brain chemicals and circuitry, which can lead to drug dependence and withdrawal symptoms when the drugs process out of the body. Drug cravings, dependence, and withdrawal symptoms, coupled with a loss of control over use, are signs of addiction. The American Society of Addiction Medicine, ASAM, defines addiction as a disease affecting brain chemistry and circuitry, which then leads to compulsive drug seeking and using behaviors. In 2014, nearly 22 million Americans battled addiction, NSDUH reports. Marijuana is the most regularly used illicit drug in the United States, and its use is especially common among adolescents and young adults, NIDA reports. The psychoactive chemical in marijuana, delta-9 tetrahydrocannabinol, TCH, interacts and binds with cannabinoid receptors in the brain, producing a mellowing and relaxing effect. Regions of the brain with high concentrations of cannabinoid receptors are heavily impacted. One such part of the brain, the hippocampus, manages short-term memory, meaning that marijuana use can impede recollection of recent events. Additional regions of the brain that are impacted include the cerebellum and basal ganglia, which help to control coordination and involuntary muscle movements, respectively. When someone abuses marijuana, impaired motor skills, mood alterations, distorted time and sensory perception, decreased memory, and trouble thinking clearly and solving problems are all common short-term side effects. Marijuana also interferes with levels of dopamine in the brain, causing the euphoric high that users document. Marijuana also has several long-term side effects on the brain, which are especially prevalent in individuals who use the drug before the brain is fully developed. NIDA warns that marijuana use in adolescence, and continued on into adulthood, may result in a loss of IQ points that are not recoverable even with abstinence. Also, initiating marijuana use before turning age 18 raises the risk for addiction as an adult. As many as 30% of those who use marijuana will suffer from addiction to the drug, and the risk is increased 4 to 7 times when use begins before the age of 18. As a person ages, neurons in the hippocampus are naturally lost, and marijuana use may speed up this process, leading to memory problems. Impaired coordination, learning issues, and sleep problems can result from long-term marijuana use and its impact on the brain. NIDA also reports on the possible link between marijuana use and the onset of psychosis and psychiatric disorders like schizophrenia in those who are genetically vulnerable. Breathing and respiration problems, chronic cough, and bronchitis are additional possible consequences of chronic marijuana smoking. Marijuana use can also disrupt heart rhythm and normal cardiac functions. Heroin and prescription opioid drugs like OxyContin, oxycodone, Vicodin, acetaminophen/hydrocodone, fentanyl, methadone, and dilaudid hydromorphone bind to opioid receptors in the brain and trigger the release of dopamine. In a sense, these drugs hijack the limbic system in the brain, inducing a powerful high that individuals are often keen to recreate, leading to reinforcing behaviors. Opioid drugs are considered highly addictive, as ASAM publishes that almost a quarter of heroin users will suffer from addiction to opioids. Over 2.5 million Americans battled opioid addiction in 2015. Heroin is considered the fastest-acting opioid, taking effect nearly immediately and making it extremely addictive, the Drug Enforcement Administration, DEA, warns. When someone takes an opioid drug repeatedly, they can develop a tolerance to it as the body gets used to its interaction in the brain. Individuals may then take more of the drug to feel the desired effects. The brain will then stop functioning as it did before introduction of the opioid, causing levels of dopamine to drop when the drug wears off. Opioid drugs also disrupt the natural production of norepinephrine and act as central nervous system depressants. Opioids block pain sensations, induce drowsiness, reduce body temperature, and slow heart rate, blood pressure, and respiration functions. Opioid overdose is an all too common consequence of opioid abuse, which can often result in severe respiratory depression that can be fatal. The Centers for Disease Control and Prevention, CDC, reports that 60% of all overdose deaths in 2015 involved an opioid drug, and 91 people in the United States die from an opioid overdose each day. Long-term, chronic heroin use may also result in the deterioration of some of the brain's white matter, which can negatively impact the way a person responds to stress, regulates emotions, and makes decisions, NIDA publishes. Lung complications and infections of the lining of the heart are additional long-term concerns surrounding perpetuated opioid drug abuse.